My Lordships, this is case number 5616 of 2023 against Leelavati Hospital and Dr. Suresh P. Joshi. I want to start by saying that the instruction manual of the warm touch machine which caused the burns to my leg, the instruction manual was absolutely ignored and not followed, which directly resulted in the burn injury. I have 3 points to mention, my Lordship. The first is the explicit warnings on page 10 and 11, which are clearly marked in extremely bold font on page 10, 11 and 12 of the instruction manual of the warm touch machine, which gives a caution symbol: no free hosing, keep the nozzle connected to the warm touch blanket. This is how I would like to read it for you: at all times, or thermal injury may occur. The warm touch care drape and blankets are for single use patient only. Thermal injury may result if the warming system hose comes into contact with the patient. Explicit and clear. The second point, which amplifies that the instruction manual was not followed, by defendant's own admission on a signed copy of their documentation, clearly states, this is the Sentinel Events Committee report, which was published on the 17th of February at 10 a.m. and signed by the head of the committee herself, says that 3 to 4 skin peel injuries occurred on the leg due to the use of warm touch machine without a blanket for almost 8 hours. The model number 501 5800, all they have taken an action is remove the machine from service. That is all they have done. They have mentioned the patient injured, they have mentioned it's a clinical injury, and they have injured the patient. The third, which shows the degree of injury of the patient, is the nerve conduction study, which is also called an EMG test, electromyography test, which has been performed. I performed it in 2012 once and again in 2024. Both the tests have come with the same result, saying severe denervation with no evidence of renervation, severe axonal injury on the left CP and the sural nerves. The clinical indications for this injury are history of severe burns on left lower limb. It is signed by the head of neurology of the hospital in Pune where the study was conducted. The explicit reason why such an injury occurred is because the instruction manual, which comes with every equipment, has absolutely not been followed. A very simple analogy, Your Lordship, is I have, because of this injury, because of the injury caused to me, it has caused immense emotional pain and physical hardship. I'm not able to perform the duties of a trainer. At the same time, I'm not able to stand, walk, and do normal things which a person will do. At the same time, this has been caused only to extract monies from me, and a similar case has been filed in the lower court after I approached the National Commission to put pressure on me to withdraw my case, and I was clearly told that if I withdraw the case, then the latter case would be withdrawn. This, I had to take exceptional dress code approval from my employer. Every day I am checked at the gate when I enter my employer's place of work, when I enter my place of work, to question why I am wearing footwear that is not in accordance with the dress code policy. It is very embarrassing. It is very humiliating for me to face this every single day of my life. I have to live with a limp. I cannot operate a motor vehicle with that foot because of the injury, and I am not able to perform my duties. My request to this honorable court is impose severe punishment, both financial, and put a hold on the hospital, because of this they are causing burns or thermal injuries to patients day in and day out.